So we previously mentioned about serotonin 3 blockers, serotonin 3 antagonists. Now we will go into the dopamine 2 blockers or dopamine 2 antagonists. So they are mainly phenothiazines, such as prochlorperazine and also chlorpromazine. Okay, so these are drugs that also commonly used in the psychiatry to treat psychosis, psychotic symptoms, such as when you have schizophrenia. So the mechanism of action is antagonism at the chemoreceptor trigger zone or the area postrema. So it's not uniformly effective in chemotherapy-induced emesis. They also have antihistamine and also anticholinergic activities that treats other forms of nausea such as motion sickness. So if you look back at this diagram, so you know that we have D2 here and the area postrema, and then we have also D2 in the solitary tract nucleus. The next group of drugs are the histamine 1 blockers. So they are useful for motion sickness and also post-operative emesis, but more commonly they are used to treat cough and cold. So they act on the vestibular afferents, okay, and also within the brainstem. So we have H1 in the inner ear, and also H1 in the solitary tract nucleus. So examples include promethazine, diphenhydramine, cyclizine, and also hydroxyzine. So promethazine, diphenhydramine, cyclizine, and also hydroxyzine. The next group are the muscarinic antagonists, such as hyoscine. So these can be injected or also used as a transdermal patch. Okay, so this drug is available in some countries and might not be available in many others. So it's used for prevention and treatment of motion sickness. So this is a drug that you can take or you can use before having a journey on a flight or a bus or something else. So it's used for post-operative nausea and vomiting also too. The next group is the NK1 blocker, neurokinin 1 blocker. So also known as the substance P receptor blocker or substance P receptor antagonist. So it's useful in delayed nausea and vomiting, such as due to treatment chemotherapy with cisplatin, and it's also used to improve the efficacy of standard antiemetics in patients on chemotherapy. So one example of an NK1 blocker is aprepitant. So the NK1 blocker, the pharmacokinetics, it's more than 95% bound to plasma proteins. So it's metabolized mainly by the CYP3A4 the cytochrome P4 in the cytochrome P450 system, we have the CYP cytochrome P453A4, so the CYP3A4, and this drug gets excreted in the stool, and it can be found in the form of capsule. And then we have the cannabinoid agonist, okay, dronabinol, and this acts probably by stimulating the cannabinoid 1 receptor on neurons in and around the chemoreceptor trigger zone and emetic center, the areopostrema, and also the vomiting center. So, and then we have the other drugs like Nebulon. Okay, don't worry too much about this drug. And then we have the other adjuncts, okay, like the steroids, okay, glucocorticoids, and anti-inflammatory agents. Okay, example is dexamethasone, which is used as an adjunct, okay, as an additional but not mainline drug to treat nausea. And then we have the benzodiazepines, okay, such as diazepam, okay, alprazolam, and many others. So benzodiazepines are used, so they have the sedative, amnestic, and anti-anxiety effects, okay, that help reduce the anticipatory components of nausea and vomiting in patients. So this probably act via the higher centers, okay, so it causes patients to be sleepy, so they tend to forget things, and they also the drug helps to allay their anxiety, their anxiousness, so it will hopefully help to reduce the anticipatory components of nausea and vomiting in patients. And then we have also other drugs such as phosphorated carbohydrate solutions. So this is a spelling error there. So it's aqueous solutions of glucose, fructose, and phosphoric acid used to treat nausea. However, the mechanism of action of this drug is not clear. So I think that's all for now. Okay, we'll see you in the next video. Bye.